Hello everyone, I'm Susan Birch with another A Healthy New Zealand podcast. Today I'm going to talk to you about metabolic syndrome, which is something we're hearing a lot about in the media these days. Metabolic syndrome is a cluster of symptoms that underpin the rising pandemic of chronic disease we're facing. And this is defined by having 3 of 5 risk factors. These risk factors are visceral obesity, so that's starting to put on weight around your waist and having a high waist to height ratio, high blood pressure, insulin resistance, elevated triglycerides, and low HDL. And both of these are measured on your cholesterol tests. It can take decades for these symptoms to develop into chronic disease. And an approximate timeline for this progression is over the first 10 years or so, you'll see an increase in obesity. And then this will slowly progress into insulin resistance, prediabetes, and then in the next 15 to 20 years, you may get full-blown type 2 diabetes. This then moves into heart disease. So after another 20 or 30 years, heart disease may start to develop, and then you'll finally perhaps get dementia. The underlying contribution to this cluster of symptoms is exceeding our personal tolerance to carbohydrate foods in our diet. All carbohydrate foods increase our blood sugar, with highly processed carbs being particularly damaging. Blood sugar needs to be maintained within tight ranges, and the optimal fasting range is between 4.2 and 4.9 millimoles per litre. And our blood sugar is controlled by the hormone insulin, and the optimal range for our fasting insulin is between 18 and 48 picomoles per litre. As our blood glucose increases after we eat carbohydrate foods, our pancreas will release insulin. And it's the insulin's job to control the amount of blood sugar we have circulating. So insulin opens the doors to the cells and allows the glucose from the blood into the tissues in the body, such as the heart, the brain, the muscles, and the fat cells. And the more carbohydrate we eat, the more insulin we need to transport the glucose into these cells. Whenever we eat more carbohydrates than our tissues can use, we have to do something with the excess glucose in our blood. And it's insulin's job to take this extra glucose to our liver, where it's converted into a form of fat called triglycerides. And that's what we talked about in the beginning, having high triglycerides in your cholesterol panel. These triglycerides are then transported around the body in special vehicles called VLDL, or very low density lipoprotein. And the job of the VLDL is to deliver the triglycerides to all the cells that need some fat for fuel and maybe some fat soluble vitamins. And then once again, once all these cells are filled up, any surpluses are taken to the fat cells for storage for later use. In a metabolically healthy person, this process would be well balanced. Fat would be stored after eating and then used between meals and overnight for energy. And this process is called being fat adapted. And when we're fat adapted, we can easily switch between different fuel sources. When we can't use our stored body fat for energy is when it's very difficult to lose weight, and we begin to rely on glucose metabolism. And this is where we get things like food cravings, we have to eat every few hours, and we become hangry when we haven't eaten for a while. When we eat more carbohydrate foods than we can use, this leads to high triglyceride levels in the blood and increasing levels of body fat. And for most people, there is a genetically determined maximum level of fat that can be stored, called your personal fat threshold. And once you've reached the threshold, your fat cells start becoming insulin resistant. Once your cells become insulin resistant, it makes it more difficult to get the blood glucose into your cells. So this has two effects. Your pancreas has to pump out more insulin to transport that glucose into your cells. And then you create higher and higher levels of triglycerides. And those high triglycerides then start to affect the health of your cholesterol transporters and your LDL and HDL particles. So your HDL, which we call the good cholesterol, those particles remove excess cholesterol from your cells. And when your triglycerides are too high, the number of those particles go down. So you end up with low HDL, low good cholesterol. And at the same time, the number of the bad cholesterol particles increases. The LDL particles increase. LDL particles come in two types. There's a type called pattern A, and these are large, buoyant, and a healthy kind of LDL particle. And pattern B are the small, dense kind, and these are the kind of LDL cholesterol particles that become easily oxidized and are more likely to get into your arteries and lead to heart disease. In the meantime, as this disease progression is occurring, excess insulin is causing havoc all around your body, and it's increasing your risk of a multitude of other diseases. And this includes cancers, particularly breast and prostate cancer, PCOS, polycystic ovary syndrome, and Alzheimer's disease. So nearly every chronic disease has at its foundation dysregulation of insulin production that's brought on by eating an excess of carbohydrates in the diet. So this is more carbohydrates than you can personally tolerate. And what you can tolerate may be different from what someone else in your family or a friend can tolerate. The solution to this problem is simple, but not necessarily easy. To reverse this complex metabolic process, the first step is to reduce your carbohydrate consumption, particularly those processed carbs with all the added vegetable oils that are very toxic to our body. And once you start doing this, this starts giving your body's metabolic processes a chance to improve and restore health. I hope you found this podcast interesting. If you enjoyed this or think this would be helpful for friends or family, please like and share, and I'll talk to you again next week.